Hi everyone, today I am going to talk about the UPSC CMS examination written paper, how to clear it. Now, we are going to talk about in this video about what is the exam pattern, what is the syllabus, how to prepare for this exam, what to read and what not to read, and how I clear this exam. So let's start. Okay. First important thing, that this examination, the date has been declared for this year, and that is 29 August 2021. Now on 29 August 2021, the paper will be held in two sessions on a single day in the form of paper 1 and paper 2. Now the timing would be from 9:30 to 11:30 am for the paper 1, then you will get a gap of 2 hours for the lunch, and again the next session paper 2 will start from 2 to 4. So you have to make your mind prepared that your mind should be working in the morning and in the lunch time both. So get prepared for that, for the two sessions on a single day. Now what comprises of paper 1? Now paper 1, usually the medicine and the pediatrics part are asked. Medicine questions are of 96 questions, and the pediatric questions we have 24 questions. Now in medicine, 96 questions, we have derma and psychiatry included in it. So total questions are 120, and the time you will be getting for it is 120 minutes. So 2 hours, 120 minutes and 120 questions. Negative marking. Now the total score of that paper 1 would be 250 marks, and negative marking would be -1/3. So the paper 1, as I have cleared, it is of medicine and pediatrics including derma and psychiatry. Now after a gap of 2 hours for the lunch, your paper session 2 is starting from 2 to 4, and that is of paper 2. Now paper 2 would be comprising of obs gynae questions 40, PSM 40 questions and surgery 40 questions. In that the ophthalmology, ENT, ortho and anesthesia questions will also be included in amount of 2 to 3 questions. So these all together also make the 120 questions. Again you will be getting 120 minutes, and the negative marking would be same, -1/3. So this is the pattern, paper 1 and paper 2, and I have discussed what the subjects are going to be asked. Now people have doubts that would general knowledge would be asked in these questions. Then no general question you are going to face in this question. Only the subjects which I have named, these questions will be from those subjects only. You will not be getting questions from anatomy, bio-C and all. Okay, now let's talk that what is the pattern of the questions which are going to be asked. So there would be 50% questions comprising of one-liners, 25% would be about the case scenario. You would be given a case scenario and you have to diagnose what is the diagnosis after reading the history of the question. And the rest 25% would be comprising of the multiple choice questions. Like 4 statements would be given to you and you have to choose either A or correct, A, B, A, B, C or A, B, C, D. Okay. Now let me give the example of all these 3 type of pattern of questions. Now first is one-liners. Now one-liner question would be like simple, like what is the crystal deposit in the pseudo gout? Then you know the answer would be calcium pyrophosphate crystals. So these are the direct questions which would be given to you. So the next part is the case scenario. Suppose the question given to you that there is a term unit, take Kipnick of 1 day, and after birth, chest X-ray, you are seeing that hyper expanded lung field, prominent vascular marking and the prominent interlobar fissure. You have to make what is the diagnosis. So after reading this history, you should be clear that the answer is transient tachypnea of newborn. So this type of case scenario would be there in the questions. And the third part is the multiple correct answers. Let's give an example that you have to find what are the correct statements regarding Trichomonas vaginalis. Now first option would be presence of greenish froothy discharge. Second, vaginal pH is more than 4.5. Third, clue cells are found. Fourth, strawberry spots on the vaginal mucosa. As you all know that strawberry mucosa are seen, that's right. The clue cells are not seen. Clue cells are the feature of the bacterial vaginosis. If I would be in your place, then I would have read that okay, first 2, fourth are true, the third is wrong. Then you would come to the options, then you see that the third option which was wrong are mentioned in the 3 answers. Only the one statement, one option, that 1, 2, 4, in that only third is not. So you can directly click that, choose that option 1, 2 and 4. that would be the faster method instead of choosing that one correct, okay, one, two. So if you are sure with your answer that yes, this third option is definitely wrong in this question, so that the chances of getting that question right and doing it much faster gets easy. Fourth question which everyone asked to me, that is this UPSC CMS is tough than the neetpg exam. Look, paper is not at all easy, but the competition is easy as compared to the neetpg aspirants, because the number of competitors appearing in the neetpg exam is much more as compared to UPSC CMS exam. So, but the paper is not at all easy. You will find that paper in the form of the INI CET pattern. Only the assertion reasoning questions are missing, but now the level of questions is not easy. I have picked up the easiest question for you, but when you go through all the recent year exam paper of this UPSC CMS, you will find out a little bit of tough exam. Okay, what books to study? See, you don't have to purchase any other or separate book for this examination. The coaching notes, if you are preparing from any coaching institute, no matter what coaching institute you are preparing from, that coaching notes and the question bank are more than enough to appear in this examination. You don't have to buy any separate book to prepare for it, neither any question bank for this particular exam. And many people say about the last year paper one, something I don't remember book names. I didn't buy it, and my colleagues also didn't buy that book. If you want, you can buy, but the last year questions I'll provide you in my Telegram book. I have a Telegram group named UPSC CMS 2021. I'll be uploading all the last 5 years papers in that Telegram group. You can join that and you can review all the last 5 year papers. So from my side, no book is suggested for you, only the coaching institutes. And if you are not preparing from any coaching institutes, then whatever way you are preparing from whatever book, so that is enough. You don't have to go for any other book. Now, what to read from that last 5 year papers which I'll be uploading? You have to go through all the papers, all the questions, and I'll tell you that how I cracked this exam. I made a separate diary for this, and I have wrote down all the like paper 1 and paper 2 and written what all subjects are asked. Now after suppose doing the 2020 examination paper review, then okay, suppose atrial fibrillation question is asked, but I made that question wrong while practicing that test. So in I'll write the subject name, and in front of medicine I'll be writing that I have to revise all the arrhythmias, ventricular fibrillation, tachycardia, ventricular tachycardia and everything. So if suppose a cardiomyopathy question is asked and if I am making that wrong, so I'll be revising whole cardiomyopathy. So this way you are going to revise. If suppose ENT question comes about the Meniere's disease, you making it wrong, so you have to revise the Meniere's disease. So by this way you are going to revise all your final strategy to be followed, because only the 3 to 4 months are left for your examination. So the 3 months are more than enough to prepare for this examination. What you all have to do is, all the subjects which I mentioned in this video, you have to read them twice from whichever institute coaching notes you will be having. Revise those subjects twice, and you have to practice the last 5 year questions of this examination. Questions are not repeated, but the top topics are repeated. So do that subject twice and practice those questions, and thus questions which you are making wrong, you have to revise that whole topic from your notes. So this is the ultimate strategy to crack this exam. You will be to paper 1 and paper 2 together will comprise of 500 marks questions per paper, 500 marks. So you have to bring at least minimum of 300 marks in this paper to be qualified for the interview examination. 300 plus is a better score. Less than 300 would land you up in a danger zone. So try to score more than 300 in the written examination. Now the next question is how to approach the paper. You will be getting 120 minutes for 120 questions. So your strategy should be in first go of 60 minutes you should be reviewing whole 120 questions. Okay, in that reviewing you should skip the multiple choice questions and the case scenarios. First do all the one liners, which usually they are in the easier category, and you will be getting them all right. Okay, after doing that one-liners, do the case scenarios, and in the last go try the multiple choice questions, because people do the negative marking in these multiple choice of questions only. Okay, if you are not sure, then better to leave that questions instead of getting -1/3, because only those are 25% paper, 75% is easy. So in 25%, if you are knowing 10% about those questions, then it's more than enough. Leave the rest 15%. Don't give your negative marking for these questions. Try to attempt for first what you know, instead of thinking that what can be the answer of that question which you are in a doubt of. So use your time wisely. Go first of all, go for the easier questions first. In the last, save that time for the tough questions, so that there are minimal chances that you would be left with a less time, or you would be you should be missing those easy questions which you can do, but you have wasted time in attempting those multiple choice of questions. So my ultimate strategy to crack the this UPSC CMS exam is, first of all, attempt the easier questions which are one-liners and case scenarios. Leave the time for that multiple choice questions. Then after finishing whole paper, try to review those multiple choice questions. 10 to 15% you must be knowing, so attempt that. 10% you would not be knowing, you would be confused, then leave them. After clearing this stage, you will be appearing for the interview stage. Then about the interview stages, I have uploaded each and everything, so you can review my channel and see what all interview questions are asked. Now, I have not mentioned the important topics for this UPSC CMS written examination. I have given you a chance that you go through the last 5-year papers and find out the important topics. But if you want me to work on it and create an important list for the UPSC CMS written examination on this video, so that I can work on that important questions also. So please share your review. Thank you.